need to start with a tray. Oh, that's what that is. It's like, what's that familiar smell? But it's just formal Cresol. That's what that is. Alright. I also need I need a mixing bowl. So let me go get that. I should see it immediately. There's one. That'll work. All right. Alright, now I'm gonna need a spatula, which I have right here. Well, I should probably switch this back from this to manual, which is going to be, nope, there we go. That should work good. Still in focus? Yeah, perfect. All right. So we are going to be making a couple of appliances on myself. and taking some impressions, doing some pour-ups, yada 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 yada, rada rada rada. Cool. All right, so I got this material, I got my impression trays. I'm pretty much gonna be pouring them up relatively immediately, so that's not gonna be too much of a problem. So I guess I can go and prep my stone that I'm going to be pouring them up in. So let me go get those bowls ready. So it's pretty much just a graceful transition from one thing to the next. That won't take too long to get ready, and then we'll be good to start impressing. Alright, so now we get to the impression. With the impression, we are going to be using alginate impression material. That's going to be this powder material that I have in my bowl. And for the most part, it is measured out to go and take an impression of the top teeth, also known as the maxillary, which is what I have in this hand. That is going to fit for, this is going to fit, that I've already pre-tested it, which is a size large. And this is also a size pretty much medium or so for the lower teeth, also known as the mandibular teeth. And from there, all I have to do is pretty much add a predetermined amount of water, or if you're pretty good at this, then you can pretty much just eyeball it off of the sink or some type of water dispensing tool, which I'm just going to use a plastic bottle with a hole in the cap to limit my water flow as we go and do this next little portion. So not too hard, not too crazy, but hopefully we can get through a good amount of steps today and get an appliance made for myself. Alright, let's go ahead and get to mixing then. Pretty much once I get mixing, I don't have that much time before I have to get it into my mouth. I have chilled the water a little bit to give me a little bit more working time, but good. Should not be too much of a problem. Alright, let's see how this goes. For a moment I am going to be silent because I am going to be mouthful of goo for about 30 seconds or so once I get my material in place. Hopefully they don't come out looking too gnarly, but I'm a professional. I should have this. Easy peasy, no problem. Right? Right. I'm gonna push this out of the way. Let that go. And we'll start from there. A little more liquid. Thankfully, because I've chilled it, it gives me a little bit more working time. I don't want it too liquidy or gooey, because I don't want it to be runny. That'd be perfect right there. Alright. This is a really large mixing bowl, but there we go. All right, so now with the impression ready, time to go in. I'll be silent for about 30 seconds or so. Mm-hmm. All right. Huh. That's always tasty. But man, look at that vestibule. Look at that frenum right there. That's just an awesome impression. But it can also be that awesome when you're super aware of actually what's going down in your own mouth and everything. So, Benny, what I'm on about today is I'm tired of waking up and I'm tired of waking up snoring and everything like that. So what I'm going to do is I'm going to make a somewhat hard, soft mouth guard with little attachments that are going to help with sleep apnea. And this is going to relieve my bite because right now with my snoring, my lower jaw is just a little bit sunken in where it just collapses my air pipe. So I'm just going to go and slide my jaw forward a little bit with a couple of these different pieces, and that's going to open up my windpipe so that I don't have to go in every single time I close my eyes ever so slightly. So that's the plan. Let's see if I can actually make it work. It's going to be a little tricky, but I'm sure I can probably think of a way to get it going. But hopefully you also had a good day at work too yourself. Cool. But I have a lot of stuff on my face. I need to get a small little mirror for my little spot here. I don't know why. I used to use a compact, but then my little lab techs went and broke it on me. Cool. So now, just gotta get my bowl clean. We're gonna go do the mandibular, and then we'll move on from there. Not bad. They won't let me do sealants. Apparently, after another day. Shut your mouth. You know the rules. You know about the RDA nonsense and everything like that. And I'm sure they're just jonesing to be like, hey, go and do a sealant over an operatory 17 or whatever you guys are up to. It shouldn't be too long, but I'm pretty sure you're a pro at it. What about polishing? You polishing? I can see you. You polishing out there? pro, yeah. Oh, had a mom mandate that only the hygienist give her kid a prophy. Super funny. 30 seconds. Let me go ahead and choke myself out a little bit with this. Oh, you know what I need to actually get? I need to get some alginate flavoring. Because, man, I always forget that that's just the nastiest, nastiest stuff. But if I had some of that root beer, or if I had some of that strawberry that we had last time, I'm pretty sure I would do just fine there. But, hey, Pada, what's up? But let's see, mom mandated that the hygienist give her kid a prophy. I'm pretty sure the hygienist felt honored to be able to, felt honored that they were selected to be the polishing person, but that'll happen a lot. I'm sure it will. Need to work on premolar PAs. Premolar PAs? Why? Because you're missing. Is it because that you're missing the mesials of the first premolar? So they're like, oh, go take it again. Because if you're missing the mesials of the premolars, or maybe you're just missing the first molar in those PA shots, then it could be something. Hygienist was grumpy about it. They wanted to go. I'm pretty sure everyone wanted to go home from there. Let me clean this out real fast. That's funny though. Let's see. Need to work on premolar PAs. The only thing I would say from there is just like kind of how we've gone and talked about it a little bit before. If it's what I think it is, gotta get out the orange marker and everything like that. It's just if you're dealing with the arch and everything like that, and your premolars are are so, my PAs are blurry and not getting the right angle. So like you're mentioning, they're blurry and everything like that. Is it like a bunch of overlapping? Because if it's a bunch of overlapping, then I can see that, yeah, like your horizontal angle maybe ain't the hottest, but blurry, huh? Because I would just easily blame the patient that they're moving at that point. Let's see. Yeah, because if you're having issues with that, because I was thinking if it was a situation like that, you already know my symbols and everything. Circles are for premolars, squares are for molars, canines are going to be triangles and everything like that. That maybe instead of having your, what can I use as a X-ray sensor? I can use my little, I'll use my little thing right here as my X-ray sensor in this case. Let me go take my gloves off for this next little portion. Before I go and do that, I want to go and take a look at this 1 second. Who is this person that we have talking about in chat? Manuela? This name doesn't pop up in my mind. If you wanna, I'm not sure who this who you're speaking about. Calliope? But like I was mentioning with this part, if you're having issues with getting blurry shots or whatever, if I can kind of bring this in, and this is your sensor, what the hell can I use as the tube head? Because the tube head's probably going to be not too much different from whatever I put on out here. But as an example, if that's your tube head and you're trying to aim right there at those premolars like I have in this shot, and you're missing it because the canine or the curve of the mouth is not allowing you to go any more further, as always, I just recommend tilting out the sensor towards the other side so that you can have your so that you can get your room midline. There we go. So we got our mouth and everything like that. Maybe too much on this side. Tilt the sensor out. Maybe keep the same angle so that the rays actually go and paint it onto the sensor like we have right here, versus a moment ago where we kept it right up against the teeth. And as we go, and if I had this actually just straight up and down, we might accidentally miss some of the rays as they don't catch that mesial of this front part. But if it's just bad angle, or if it's just blurry, then maybe there's just way too much angle for like a premolar shot, and we just need to kind of ease up on the angle. That's all that I can think of, kind of over chat at the moment on what could be causing an issue there. Go and cap this. Let me go get some stone so I can go to our next portion here while I keep this up for a moment. Get my impressions ready. And, because I don't want to feel that stone on my fingers, get some gloves. Yeah, I do that. I bet patient is moving it, but maybe I'm overdoing it a little bit angle. And you know what, too, with that, too, because it's coming so far forward and everything like that, it might just be rough for them, and they're, like, chewing on it, almost. They're almost, like, quivering their jaw to try to not bite down all the way, like you asked them to, and they're just kind of quivering to try to keep it in place for long enough to hear that button push. And that's probably causing your true blurriness that you're feeling. get some stone going on. I should be able to pour up this impression twice. But yeah, if anything, that's what I would probably guess on their side, is that if it's a true blurriness and not just overlapping and everything like that, it's probably because they're trying to follow your orders. It's just hard for them. And I mean, I don't know if there's a way to make that a little bit nicer or kinder, because the X-ray sensor is so rigid and strong that if you were to add some type of cushion to it, maybe it'll work and it won't give you too much. It won't push the sensor back as much. But I don't know what you can cushion it with. I mean, you may have experienced it when we were doing patients. Was we had these little cushion ease or easy cushions or whatever like that, and that would work. But I mean, your place has to order it and have it available for that to be an option. But for sensors like that, it's tough to get some type of nice way to do it. Okay, so I need this. I'm gonna need my vibrator. Shut up, Ben. I know you weren't gonna say anything. I'm missing second. Let's see. I'm missing number 2 and number 15 in bite wing shots 2. Why? All the way far back there, and you're missing it. Are you missing those shots but still getting? Are you missing those shots but still getting your? Let's see. Are you missing the second molars but still getting open contacts while you do it? Just kind of to verify something, I want to kind of verify with that. Let me get this on. I need to switch out to my vibrator. And this is going to go over here. Cool. Oh, missing bone level. That's a little bit of a different thing. Okay. So, flip side type of deal. If you're missing those upper bone levels and everything, of course, like we taught you, try to make sure that your circle where you have your little horizontal line, how we always wanted you to match that horizontal line with their smile line, and that works. But if doc is contacts are up and awesome, but if you're having an issue and doc's calling you out on like, oh, where's the bone level and everything like that, a couple things to be able to help out with that is kind of going back to the whole sensor placement here. We have our teeth in, we have our sensor, we have the bite wings and the bite wing tab that sticks out and everything like that. Where did you get your ring at? You saw my ring? Oh, I'm assuming that you're talking about this one then, at that point. But if you are talking about my little tooth ring, I made it right here at the bench. So definitely that is something that if it's at request and some people want it, definitely I'll replicate and make more and such like that. But like I was mentioning, Ben, over there, if you have your teeth set like so, or your sensor like this, your bite wing tab is sticking out just as normal, as simulated as my fingers. Go ahead and back up your image. Go ahead and back up your image a little bit, your sensor, so that your thing can, so that your tube head, as it goes and paints the picture, you have just a further canvas to be able to capture more of it. That's one tool. Now, the other thing that you can do, which is going to be a little bit odd, and I can actually use my denture case here as an example. Not really too much of an example or anything like that, but if I have them biting down in a weird way and such. Where's my X-ray? Where's my mock X-ray tube head? Oh, there it is. Cool. Now I'll use this one. Cool. All right. So you have your your cone and everything as straight as possible, which is usually how I teach you to do. Make it straight, make sure that the line and everything matches. Let me put a pseudo line that matches where that tooth line is. But instead of matching and keeping that line straight with the edge of the teeth like I had you guys do before, if you come up a little bit and do a 5-degree or a 10-degree angle, that's something that can help pick up those upper molar bone levels and push it right onto the actual sensor. So that's why I would recommend, more than likely the 5 to 10-degree angle is what you'll want to do, and that will give you those upper bone, those maxillary bone levels that you might be missing. But as far as going further back, I mean, that's just going to be something you experiment with and your patient works with you with. Hopefully. But I think, yeah, at a positive 10-degree angle, positive 10. And of course, this is going to be freaking back. Oh no, it isn't backwards. Oh, cool. And it looks like 16, but positive 10 vertical angle for bite wings. I think, yeah, for bite wings. That's what I would do. Good question. I will call you Kiki over in Twitch chat and everything like that. I am a registered dental assistant. Yes, look at it. You found it. You caught it. ADA. I am a dental assistant. I've been doing this for something like 15 years almost. In probably about 3 months, then it'll be 15 years or so. But I like to do dental laboratory stuff. And like earlier, I took some impressions of myself. And I'm going to be making myself an appliance after I finally get this stuff all poured up. But like you mentioned before, with like my ring, that's all. This is This is denture material, denture acrylic, and denture teeth, like we have in these little plaques that I have here, that are that I shape usually to whatever I want to do, and that's why I also have a denture that's in the process of being made for someone. So I kind of do a lot of everything. The only thing I don't do is poke people or scrape people's teeth. But like I usually tell everyone, once they see my ring, if they freak out, then I know that they probably think it's I'm weird. That's a cursed item. Weird. Why would someone want to do that? Same RDA in California. Pay rates around 24 to 28. Oh yeah, definitely. What are you? So then you're probably not. If you are California, then you're probably not more Bay Area. You're probably somewhere within this this Northern California range or so. I would assume. Unless Southern California is paying at that rate also, because I know those Bay Area dental assistant or RDAs are making good moolah, but they're definitely paying more for those benefits. What I want to do? That's what I want to do. Let me get mixing on here. I don't want to use this one. This one's a little too soft. Where's my good one? There it is. But cool, nice to have a dental person join the stream. Dude, I need $24 an hour. Dude, you are going to climb that. You're going to climb that green ladder really quick. I know you will, especially once you finally pass your test, which is going to hopefully be coming up soon. That's going to be right up your alley in not too long. Right about there. Same RDA in California. Pay rate is 24 to 28. Man, I remember when I started out, and it was like, I think I was getting paid when I first started out at like 10 bucks an hour, like 15 years ago or whatever, 14, 15 years ago. And sheesh, it has climbed. Definitely has. Turn on my vibrator a little bit. that just a little bit more, just a slight more runny for my teeth. There we go. But shoot, you don't need 24, Ben. You're gonna be climbing that. You're gonna be up higher than that, way higher. You're gonna be trumping what I make. So you just keep the good fight fought. I remember when I thought $10 was making bank. But the thing about it though is back when we were making 10 bucks an hour at the time frames and everything like that, that managed a lot of things. We were able to make it work at that point at enough. Shoot. Around here, especially depending where you are, man, even if you're making up in that 24 hours 24 an hour, sheesh. You still could be struggling now. Especially since gas is getting up to like $6 now. Shoot, that thing's climbing to like $5.50 if you're on the cheap gas side. So hopefully you don't have to drive too far or anything like that. Yeah, I get paid 24 an hour in private offices. I'm asking for money and rent. You better be. Hopefully you got I'm pretty sure you got the skills to get the bills paid. Keep asking. Do you have any treatments that you like or that you're good at? Anything that you specialize in? Or, as another thing, have you ever considered going and becoming a expanded functions or EF2? Even though it's like a bunch of money. Alright. Treatment. Let's see. Root canals and implants are my favorite. Hey, I got a fellow endo person in the chat. I love root canals, even though everyone, rightfully so, thinks they're boring. I'm not gonna deny that they aren't, but I'm not gonna deny that they are a wee bit boring. But if you got a doc that talks to you throughout the whole thing, and you guys have decent conversations, it's pretty fun. Hey, what's up, Rep? Welcome back. It's been a little bit, but I like that. You're back. Let's see, but you said root canal and implants. Implants were pretty fun too. I liked implants, especially if your doc really trusted you with taking control of the procedure and trust you with handing off instruments or tools, or they're like, oh, give me the SDI implant, BioHorizons, Anchor Los BS nonsense. You're all good. I'm very intermittent about when I actually stream, and then also what am I streaming at that time, because I could be just doing like Kingdom Hearts, or maybe I'm at the bench or whatever. So don't worry, I'm very unorganized with my schedule right now as far as what's going on. I'm gonna go and make a base layer here. But yeah, implants are neat. They're fun. Just reverse extraction, right? Especially if you can do extraction and same day implants. That's always a nice and a lot more simpler one to do. I don't want this mix to be as runny. I want this to be a nice thick base that I can work with. But I don't want it to stand too tall, because I don't want to whip up and I don't want to set up my model trimmer for trimming it down. Hey Kiki, thank you for the follow. Every now and then I keep on building more dental people or people that are looking to get into dental. I remember you. Yes, sir. Don't worry, I don't forget that too often. I'm not that big enough to be able to forget my my starter followers here just yet. And I doubt that will ever happen. So I'll keep with my usuals here. Alright, let these set up just a little bit before I flip them, and then we will be doing gold. I know that is a nice thing sometimes if we can make it work, right? So I'm gonna go and let this harden just a wee bit. We'll go and flip them. I'll go and cutesy them up a little bit, and I can go and get this cleaned up a little bit more. Let's see, what do I want to use? I don't want to use this because I can use this for some instructional aid later. I'll have to make another one, make a new one. Alright, let me go and clean this up real quick. All right. And are you making the night guard right now, or did I miss it? No, I'm pretty much in the process of it right now. Oh, I like that you. That's right. You caught the title and everything right now, or you caught the title. At the moment, I'm not making it just yet. I'm gonna wait for these models to set up a little bit more before I go and pull them apart and then pour it up again, because I want two sets, one working model and one master model. But I do have a couple other models over here that I'm going to work on in the meantime, doing the same exact thing, because I need to make my wife another one, just in case she goes and loses the one that I made her the other day. Okay, so we can go and do a gentle wee little flip. Same thing on this one. Now that it's hardened up just enough. And with that, I can go and cake it up just a wee bit. Make sure it's high where I need it to be. And then as it firms up a little bit more, I'll make definite cuts to the side to make sure that I don't have anything to trim later on. These are everywhere. My wife snores? Nah, no. She just actually just grinds her teeth because of me. I'm pretty sure she, with all of her stress of dealing with the Miller, that and the kids, that she's just a grinder. Or not really. She doesn't really grind her teeth. What she does is she clenches a lot, and so she'll wake up with pain in her TMJ, and so that's where the night guards come in. That's where the night guards come in. So that's what I'll be doing also. Alright, so I'm going to go and let this set up over here. Over here. Don't tear on me. There we go. That can be off to the side, doing its own little thing for right now. Let's go ahead and set the stage again. And let's move back to her model, which This isn't her. Where the hell is her model? She gave it to me yesterday. Or she gave it back to me yesterday. Oh, I put it in storage. That's what I did. I put it in my storage bin. Alright. So it isn't a watch the mold dry stream. It's almost just gonna, it's pretty much gonna be something like that. Watching paint dry and everything like that. Thankfully, shouldn't be too crazy. But while my mold dries, we're gonna be working on this and doing a night guard, which I already had a model. I've been using this model for a while. Thankfully, her teeth don't shift too much. But that's what we're gonna be doing here. Is working with this one for right now. And with that, I need to go and select a thickness, which I am going to use 080 thickness for my night guard. And as it comes to time here, not too long, then we will we'll go and observe the process of the vacuum former. Since it really doesn't take long at all. I just need to go and set my wax pot, which is super hot to the touch. That is something else. Alright, I can go and pull this back, get this set over here, and get that in position. These are still doing stuff. Get some water. And let's pull my vacuum former to be center stage. Okay, I need to plug that in real quick. Let me see one of these vacuum former, and I will take out my induction heater in with the former. All right, so let me see if I can point this into the right direction. I need to go and shimmy shake this so that you guys can still watch it dry. And let me go and I am going to go and mute. Try to angle this up. Let's go down. Let's go up and over. And because it looks all stupid, let's go and flip the stream vertically. And that should put us in the right position. Yeah, something like that, right? Something like that. All right, so first thing that happens, we go and take our model, which right now I have a lot of my cuts already set in place. I'm going to switch this over to, nope, wrong place. There you go. I need it right there. We usually test the placement of our piece here. And now I know that there is plenty of room all around. The next piece that we're going to do is set my material, which is like this. Only thing that's different about this is that it is not blue. We go and tear away the outer coating, which is keeping it dry. And we have a thick boy, but it is a clear boy. And it has all those nice bendy properties that we want, but that's what I'm gonna want in this case. So we'll set it right here onto my vacuum former. We're going to make sure that all the corners, all the edges are on this little rubber gasket that's there. And this is going to clamp onto this port, and it's going to be held by this little clamshell. When I go and push this up and down, I have to take a hold of these knobs that are over here on the rear to be able to do a lot of my actions. Now if I can back this thing up and shift it up just a little bit, we can see some of the other fun things that's going to happen here. Cool. And so now we look at this next part, which I got my heater up here at the top. Now this heater, once I go and turn this little switch on, it's going to illuminate this little orange light, and there's a heating element that's underneath here that's going to melt the material that I have down here. But what I want to do is I want to bring up my actual material all the way to the top as best as possible and allow myself some room to place my model. Now, once it starts actually melting the material, all my material is going to start going wavy and everything like that. I can go and hit the, it's going to droop, it's going to melt and droop a little bit, and then I'm just going to go and slam this down, turn on my vacuum, turn down the stream for one, so that you guys don't get your ears blown out, and then we can move from there. So, all we do is just we sit here, and we just wait. And you just stare at it the whole time. And you never take your eyes off of it. Never. This is the real Snorefest, is waiting for this to finally get that going. Yippee, right? It's a bunch of just waiting for stuff to happen. And while we're waiting for the stuff to happen, I can look over here at my impressions and see that they are drying. They're not fully hardened to the point where I want to make different cuts into it just yet, but we're gonna get there. Right now I have my material, it is bubbling right now, so it's kind of just going through its melting points. I need to get my finger over here on the audio so I can turn it down when it's the right time. An impression, not molds. I knew I had the word wrong, or are they interchangeable? No, you would use impression. You would use the word impression, but you're at least, but you have the right idea. I mean, if you were to say mold to another dental person, they would understand. If you were to say it to a patient, could be dicey if they understand it or not, but you got the right idea. Alright, so we are getting some droopage going on. I'm going to let it drop just a little bit more. Alright, I'm going to cut the feed. Bring it back up, and it's super loud. Alright, there we go. And now we got our suck down mold, right? And if I go and do a little up close visual of it, you can see all of this nice hot plastic that's still melting hot. So I'm gonna wait for it to stiff it up a little bit. Another little tool that you can kind of use is if you get a wet paper towel or something. Usually I've seen like wet paper towels, I've seen people use cellophane or saran wrap, and they'll go and take fairly cold water and they'll go and pinch the sides of the hot plastic to make it, for one, cool down a little bit, but also snug up against those teeth. Dentist, I'm gonna put this molding stuff in your mouth. Patients, oh hell nah. Oh hell nah. You're too funny. But yeah, and I think, and pretty much that's what it ends up being, is just you just pull out the correct terminology for the right people during the right times, and no one should be going too crazy about anything like that. But we got this going right now. My actual cast and my cast and my suck down material, my tray material, is chilled a little bit, but it's this outside stuff. This is going to be what's still hot. So if I go and back this up a little bit, you can see that I can go and pull this up. It'll expose my thermoplastic that I had earlier. This element at the top still hot right now, but my system is off. I can go and pull this up and just get it opened around it, and now I got my piece, which means I don't need my vacuum former anymore. So I'm just gonna go and put it back in its station, slip it back to its corner, and I can get myself reset up for top-down cam. Top-down cam. Oh, I need to be high. I need to be taller. I think that should work. All right, so we got two things going on here. We got my impressions, and I poured it up with some stone. We got these pieces. I'm gonna let this go and firm up a little bit before I do my next little portion. But I do want to cut this out a little bit so I don't have as much to trim later on. And so I can go and just take a little bit off the sides, right there. Can take a little bit off of there. I don't want to go and push down on my impression too much or anything, but it is pretty set where I want it to be. And I do want to have a little bit of water over here on the side. This is good on the back. I can clean that up a little bit later. This is good over here for the most part. I'm gonna go and thumb this tongue area down a little bit so it's not sticking up as much. And then we can let everything kind of set and settle from here. Let's see what we have. What's the impression material called again? I may not remember the name, but it's nice to hear again, because if I remember, you mix one thing with another thing and it activates the other material. Absolutely. So the material that we're using right here is what they call a type 2 impression material. But also known as a irreversible hydrocolloid. Now that's just like the dental name and the actual like, oh, like to the book, this is blah 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 blah. But what it's called is alginate. Alginate. So an alginate impression is what we would usually go and use. I have some stuff like this, and of course it is freaking backwards. But this is alginate impression material that I would be using, and I can use this, which is a powder, just like so. If I can get a decent actual focus on there. But that is my alginate powder. Usually comes with like a scoop type of system and everything like that. I'll pop it into a bowl like I did earlier with these impressions, and then I'll go add some water, whatever water, on the side to go and get that to run. But kind of something, because you're more over here on my Twitch side rather than my YouTube side. I make YouTube videos about a lot of these different things. So if you ever want to kind of like revisit taking impressions, pouring up models, trimming models, doing all the things that dental assistants mainly do, I have videos about every single one of these, and it's kind of in a little bit of a deeper form of informing you guys, and with some memes going on in it. Same exact name, dental things. Yep, that's the game. But if you just look up dental things, it's just going to be a tooth inside of a red background type of wall, and then you can see a lot of my stuff going on over there. And also where you can catch me in case I'm not for some reason over on Twitch, I may be over on that for some odd reason. But these are firm enough that I can actually pick them up and make a mess of my freaking counter. But I can go and take these, I'm gonna go put them over here for a little bit. Probably in about 15 minutes or so, 10-ish minutes, I'll go and pull them. And then we'll pour them up again to go do this other thing. I also watched an underbite overbite surgery video you talked about animated, and it was interesting. Oh, you must be talking about a Le Fort or a double jaw surgery. Very interesting stuff. Yeah, I think there's one that's called a Le Fort. I think it's called Le Fort 7, and that is gnarly. Where they take an electrosurge knife, they cut open the gums. Ben, you know this one. This was probably like your second term or something like that. If you are here, I know Ben, you're probably gone. But yeah, Le Fort, yeah, they'll go and cut the gums so that they can peel it back, see the maxillary or the mandible, and go make their cuts where they need to. It's pretty gnarly. I don't know if it was the same though, because the name I googled didn't really match what I recalled you saying. Yeah, it's let me go and bring it up so that you can kind of have a. You can go on a nightmare-fueled binge of material. Le Fort 7, I think that's what we called it. Maxillary surgery. There's one that I specifically show a lot of my dental people, and it's pretty raw. But there's tons of other versions out there too that meet that same criteria. Let me go, and I know my other has it. Dang it, that's gonna bog me down. It is. Go over here to my library, and I have. There's my complex oral surgery videos. Oh, that's what they call it. This one is very gnarly, but this was one of them that I had. This is one of the videos that was shown to me. Orthodontic surgery, yeah. Yeah, orthodontic surgery essentially is what it's called and everything like that. What's it called? But when I was going through dental assisting school way back then and everything, this was a video that they showed us. Probably the first or second week, trying to make sure that we're not having issues with blood or anything like that. So that's so they are the same thing. Orthodontic surgery is what I watch. It pretty much is, because you're dealing with ortho, which doesn't mean which is going to be straightening. Ortho means to straighten. Gnathic is going to be like the origin or the setting of the jaws. And so if you're going to be straightening the jaws, either you're doing it for the top teeth or you're doing it for the bottom teeth. And we just kind of move around from there. But if you look up that video, that one's gnarly. Like, first 10 seconds, you're like, ugh. But if you're people like us, that thumbnail does not help either, yes. But it's that first 10 seconds that really is a kicker. Now, you will never, ever see this in a true regular dental setting. But if you go surgery, if you go oral surgery, this is something that I'm pretty sure is going to be an option to do during your time of residency, during your treatments that you'll set and everything. But that's one of the pieces. So you enjoy going to sleep with that on your mind, because definitely it is something else. But I like showing that when we get to our other things. That looks like a horror contraption. Oh, absolutely. Oh yeah, it is something else. So now that we're done kind of going over there, and my material is nice and solid and firm-er, we can go and cut a lot of this out, which I'm going to go and do with some crown and bridge scissors. That's why I watched the animated when I did. Oh yeah, you pretty much kind of understand the process. Now they're just showing you the dirty stuff. Another thing I want to do is I want to go and trace my lines here. Let me go and dig deeper right, for this next portion. Oh, I also need to go and switch out of this mode. There we go. That's going to make it so that everything's not overexposed. Let's see. Let me switch this. I want a what is this? All right. What I saw is that they cut part of the bone and either remove it or move it in two cuts to set it back, or pull it forward with just one cut. Yes, for the most part, if you're thinking of the one cut system, more than likely that's going to be for the top teeth. If it's a two cut system, because they have to go cut the left side then the right side, that's more likely for the mandible or the lower jaw. And man, either one of those surgery types are just kind of pretty crazy out there. It looks interesting. I can like watch the videos and everything without like, with probably eating popcorn and eating my normal meals without flinching or anything like that. But I don't know how I would be if I truly had to go through and assist it. I know some people, once they get into that spot, into that part, and they get to the real bloody things, they get a little lightheaded and woozy. Which, who knows? I don't know. Dental blood is just very different than outside of the mouth blood. I'll just call it weird ways like that. So seems like it's not that bad, but who knows? Let's see. Also one, also one where the teeth didn't touch because some interruption with the back teeth where the teeth in front didn't touch at all. Definitely. So that probably make them so they had when they closed down that it was more of an open bite, so they didn't get any true cutting action. I think it was 2 cuts per side, so they could remove. Can't remember 100% call, or 1 cut depending on the type. Yeah, pretty much great, neat things. And usually, a lot of times in those situations, I would imagine, and probably from some of the videos that you see, there's multiple doctors, dentists in the operating room, making sure that everything goes smooth. It might not even be something that an assistant would do. It might be something that a a surgical technician or nurse might be in there for. More than likely, those people are oral maxillofacial surgeons, OMFS, and they're the experts of reconstructing the skull and the jaws and everything. They work side by side with the ear, nose, and throat doctors and the plastic surgeon doctors and everything. All right. And so my models are probably firm enough for me to pull apart here in a second, which I'll do. Just want to get this off of this model here before I move on to that. Alright. Alright, we got our impression, or we got our first model. Before I go too much further, let's go ahead and pull my other models that I have here, which right now the key thing when you're going and working on these is checking to see if your cast is still warm. And so right now, just to the back of my hand, this is still warm. So normally we wouldn't go and pull this apart because it's risky that you might break the actual teeth parts that are inside the impression. And you also see it sweating right here on my bench a moment ago. Bringing the working with nose doctors reminds me of when my dentist said for one case the guy was getting a root canal. Near the sinus, and he said to reverse the drill process to push the bone bits back so they don't puncture the sinus, fix the person's sinus problem. Yeah, a real big thing, especially when it comes to doing, like you mentioned, with root canals and such, that you might have issues where we might be getting close to the sinus and everything like that. Got to bring out the paper towel drawings and everything right there, especially for these. I'm going to flip my camera around so I'm not upside down. Let's see, flip Bert. There we go. Cool. Now you're tracking. But usually with like the molars and everything, we can see the crown portion, which looks like a butt right now, but we can see the crown portion, which is what we see in the mouth. That's going to be visible. Then we have our next section, which is going to be our gum tissue, which I'm going to draw as triangles. And then we have the roots. Now a lot of times it's going to be, especially for a maxillary tooth, whether it's a molar or a premolar, or again, usually you're going to have multiple roots. So in this case, as I draw this molar, usually it's going to have, in this case, we're going to call this the mesial root. We're going to go over here, and usually there's going to be a distal root. And out of these, and I think you brought it up from earlier, or someone did not too long, there's going to be a super long one, which is going to be called our palatal root. And so we have mesial, that faces towards the front of the mouth, distal, which faces towards the back of the mouth, and the palatal root, which faces a little bit more towards your hard palate. And so everything's kind of like this three-pronged system for the top teeth. And like you mentioned, what happens if we have a sinus that's almost like a cloud and it comes and hovers right there towards the edge of that tooth? And so we have our sinus. Now, anything that we do with this root, especially if it's a root canal, which we're just cleaning the inside of this canal, of all of them really, if we have a instrument that's going in and out and everything, and we can use this as an example, as it goes in and out and cleans up everything, if it was to go past and up into that sinus area, well, that sinus is for the most part hollow, but it does have a there is a little balloon in there, and we wouldn't want anything up in there because it's going to cause issues. One of the issues is bleeding. sometimes when you go and take molars out or canines out, because they're so far up there in the maxillary sinus and more over here towards the front, so this is going to be a maxillary sinus. And then up here in the front, there's going to be another sinus, which is called our nasal sinus. That is usually where our canine root goes really far up into there. And because canines are super long, that's where they end up too. So no matter what, whatever root is closer, if there are sinuses that are super dragging down into that system, they super want to watch out for. And like you mentioned, they told them to reverse the drill so that instead of pulling all the bits out, it pushed it back up, and it probably created a nice little roadblock so that it patched it right up, and they got lucky that it did seal. In some cases, they might put different materials in there. I know one of them that's really highly used is called MTA, mineral trioxide aggregate. And that's a pretty solid, expensive material that's useful for patching up holes and perforations that are made in the oral cavity. It's very well accepted by the body and such, so that's usually a good thing. But definitely tricky when you're working on these, and that's why sometimes root canals or extractions that deal with really close sinuses, like the canines and the molars, or on the lower that are getting really close to nerves, they'll just send it out to specialists to get them worked on or taken out. But it's tricky when you're working in certain areas, and you have these people going and you have some people out there that are like, oh, I'll just do that, no problem. I watched it on YouTube, and it shouldn't be that hard. There's just a lot of nuance to it. Post root canal extraction of the canine, and they're creating an area where they place the artificial root that the bone builds around to place it into the crown. Oh, okay, I see what you're going on with that. That's smart then. Definitely, they've been, and like they're the doctors and everything. They make good calls, and I think like you mentioned before that it kind of started with another doc that kind of came into the conversation and had words, and they pitched ideas to each other, and they're like, hey, do this and that, and we'll have a coin flip if it works or not. But you are a smart cookie to be able to remember these things and everything. You're gonna be doing well once you get there, and it won't be too long either. Let's see. There was definitely talk between the doctors, but he showed me the X-rays for this last year, so it's a little foggy, and of course my terms are vague. Don't worry, you're fresh into the system. You haven't like some people, like the old saying goes, you haven't even cut your teeth fully into the whole into the game yet. But you've been doing well observing, understanding, kind of processing, and walking yourself through all these different troubleshooting spots. That's where the interest is really great, and that's where it starts, so that you can use all that, and you can remember back to when your doc mentioned this and talked about this, and use it in your own practice one of these days. My cast is now a little bit colder, so let's go ahead and pull these from the molds. Thank you, I'm sorry for the delay. Material. Okay, cool. I can remember what the things look like and do, but not the exact names. Yeah, you'll get it. It's just, it's part of the process. Alright, let's go ahead and take these apart. We want it to be very gentile. A lot of times just grab it when we make a nice thicker base and everything like that. When we do these nice thick bases and everything, you can just go and grab onto that, just give it a good slap, hold on for your life, and just gently rock and roll it up. Don't just do crowbar actions and rip it off, because then that's how we usually break teeth. And usually we always pray so that we don't have bubbles that's hidden inside of these when we pour it out. So with that, it's a little up and down, left and right, forward, back, a little bit of a rock, a little bit of a roll, and from there, we got something going on. And my impressions are still decent. I can probably get at least one pour on this, which I will do here in a second before I move on with a lot of other things, before it goes and dries up. My maxillary cast, same thing. Go and pull it up, and I have now my full set. Now the main thing that I'm working with on this is I really don't need too much of the teeth, but I do need like the major structures, because I'm not making something to go over my teeth. I'm going to be making my little retainer Howley appliance with it. So since I still have this and this is still working, pour this up again real quick and we'll be good to go. I had a person message me a moment ago, so let me go and just give them a howdy doody hello. Just a quick moment. Oh, it's probably because they did. Thank you for the kind words. Alright, good stuff. I like that. Is this similar process to Bluestone that you were talking about with the dentures? Yeah, because over here and everything with like this denture set that I have, I poured up in blue, and you might be wondering, well, why is that part blue, but then like the base parts that it stands on is white? It's just because the white, the plaster, is weaker material. So if I go and just take a little, if I go take like one of my hammers or something and kind of smash into it, usually the two separate casts, the stone from the plaster, will separate, and I can still use my stone models, and the plasters I could just go and break into the garbage bin if I want to. So that's the niceties of having certain materials for certain parts and procedures. Let me put this off to the side. Let me go and get my bowl so I can pour this up again, and then we'll go and work on these where I'm going to do some wire bending to make my appliance pieces that I want. Okay, so someone messaged me again, had to type out to them. Let me get this stuff, and We'll mix it in here. All right. Okay, cool. We got my stuff. Got my water. We got this. Just subscribe to the YouTube channel. Definitely a lot of cool stuff there. Thanks, definitely. And that's the thing, is just like some of you guys that find me find me somehow, and you end up sticking around. It's pretty chill. It's definitely a treat to be able to share what I know with people that are interested about stuff that I know, that can make use of it one of these days. Alright. Get this going. I probably won't use the vibrator on this one, but usually if you got good tapping game, you shouldn't have too much issues with it. And you make it thin enough. I assume your videos are to help dental assistants. The whole reason I started that channel was mainly to help my students at the time catch up when they couldn't be there for my demonstrations. But as I got going into it more, I want it to be a place where if in your state you're allowed to learn on the job, that you have the ability to learn from someone that's been trying to teach it to people in different ways. Another reason why I kind of think of it as a option too is that one day my kids will one day have to join the workforce, and if I'm still around, I can teach them how to do what I was able to do and what I learned. But that's kind of another place where they can always watch their pa, I usually go by pa, where they can watch their pa do their stuff. And so it's kind of a little time capsule of, hey, this is what your grandpa used to do. See, and you try to make funny videos, which don't work out as far as comedy today, but it's a little time capsule for myself to kind of see what I was doing at that time. So that's kind of what it's become more of, is in case I ever start losing my ability to think or remember, that I have something to go back to one day to reflect on, as odd as that may seem. So I think it's kind of it helps a lot of people out, but I think it's mainly so that I can have something to watch when I'm just not feeling it. I can always go back to my crass or rude or meme comedy that I've been trying to do. Let's see what I can get from there. Yeah, and also too, when it comes to that, yeah, exactly. Great great way to use YouTube. If they're still around at the time when I'm gonna need them, hopefully I'll always have them to go back to. But it's a neat thing. It started in one way, became another, And a nice way to actually get good at learning something is to find a way to teach it to someone else that doesn't know it. So if you're stuck on learning some type of terminology or learning some type of concept, learn how to try to teach it to someone that doesn't know it at all, that can't really critique you as far as correcting you. And if you can teach someone else it, pretty much, if you can teach someone else it somehow, and I kind of use YouTube to do that too, you'll really remember and know your craft. You'll know your craft to be able to analyze yourself and to rephrase things and to look at it in a different light. So it helps me out in many ways, but it helps other people out if they're here to enjoy it. Alright, so I got my material here. I did that. I have to think about it over the weekend. Oh, cool. Yeah, this will be good. That's my favorite way of studying. I like to study with someone that asks a lot of questions so I can explain it and catch the mistakes. Exactly. Exactly. It is definitely the hidden technique of learning, is to study group it as much as possible, right? Figure out what you don't know when you're explaining it and be like, oh, I really don't know how to explain that. So let me go figure it out and learn how to do it real quick, because that was a good question. I made this a little bit too liquidy, but that's why I keep some backup powder. That's why I didn't want to use it all at the beginning. Let's get this a little bit thicker for my stuff that I want to use. Yep, worked for me in math and AP Bio when I was going over cellular respiration with photosynthesis. Yeah, and thankfully it's stuff like that where you can really kind of put life into the subject. You can, it's not just, oh, here's a concept that we don't use in life or anything like that. But if you can kind of breathe life into it and bring light to the subject, like photosynthesis and everything like that, and bring some real world examples and solutions, then it is the best way to go about learning. Done with this. I can return this to its maker. I'll let this set up so I can crunch it out and clean it easier later too. Alright, so now with that, this has a little bit of a thing to it. If I go and give it a couple taps like this, it's going to try to pancake out a little bit. This is fairly done. I need to go and clean up some of these edges that are on here. Some of them are hidden pretty well, but there's some edges that stick out, little hairs. So I'll go work on that. Let's go pull these bad boys over to a corner where nothing's going on. Nothing's really going on over here in this corner. And let's whip out my bad boys right here and go over this. Now, I still need to trim up some pieces. I have some areas of my cast that stick up almost like little feet or like little ankles and everything. Easy way to be able to clean these up is to just go and break them off. But using a model trimmer to go and push it into a spinning diamond disc wheel is the most optimum way to do it. But while they're still in their setting stages and everything like that, a really kind of nice way to just clean them up is a pair of shears. A pair of gardening shears that have enough fulcrum and force at just the right points to be, and cutting force to be able to just clean them up really easy without taking them to the model trimmer and making a whole lot of noise and water and dust and everything. So usually this tends to be a solid piece and nice because you can just kind of line it up to wherever you want to. Line up the cut, and as you go and just make that, it just goes in and lays it off. So I'm going to go and clean these up a little bit over here at the garbage can. I'll be back in frame in just a second. All right. All right. Back to the table again. Put the shears away. Change up the music a little bit. Let's go to this. All right. Now we're going to be on to our next part while this is kind of setting up, which it's firmer. I could flip them. And you know what? That's what I'm going to do. I'm just going to go ahead and flip them for now. Same with this one over here. Cool. We'll let those go and do their thing. Clean up my space a little bit. And now, these are going to be my working models that I'm going to go and use. And we'll see how these ones come out a little bit, if they come out a little bit better. My lower came out decent on this one. This one has a little bit of air bubbles where I had some things get trapped. But the main piece of this all is that this is going to be my, this is going to be where I'm going to do my wire bending off of these models. And I need I need a specific burr to clean up this little spot. And I actually need to re-hook that up. What do I have hooked up that I don't need? I don't need my vacuum former. And I don't need my vibrator. That's a 30. I want some extra form to be out here. This is a thick one too. Did you see the movie about Puss in Boots where he appears as his brother, who is an egg, in search of the goose that lays the golden eggs? I think that's the first one, right? And the thing is, I haven't. Also, hey Pata, I'm pretty sure I've been here with, or you've been here with me like this whole time. But I think I've seen the first one, but I haven't watched it on purpose. Like, I've caught parts here and there about the movie, and I thought it was a neat idea, but I never fully I never fully watched it. I need to probably show my kids it. They'd probably enjoy it, and that would get me to be able to finally finish it. Oh, you're all good. I figured that you're here, and you're just, and I figured you are here. Don't worry. When I look at the numbers, I'm like, I know you're out there. I didn't keep quiet, but it made me laugh because I'm left with you. Because I'm left with Cat, and I was always out there. Aw. Oh, that's too much. Don't worry, Pata. You're one of the originals. You're one of those that stuck it out with me this whole time for some reason, but I'm glad that you are here. I need my wire cutters. I need some of my wire benders. Tools. Let me see. We'll put this off to the side. Okay, let's see what you said, because that was something important that I saw here that came up. Said, I was bored. I dropped out of my graphics design career to never see it, and now I'm in my technology for a subject. I have to make an animation. Then you've had a pretty pretty neat way of kind of getting back into that career subject. They're just trying to give you another go at, hey, are you sure you want to leave? I'm pretty sure that you would be good at it. You probably got good talents in there. Alright. As long as you don't go into dentistry, you'll be fine. But I've had even then, I've met a dentist when I met a dentist that had a computer science background, and they ended up making the change to dentistry to become a dentist after they realized it wasn't interesting to them anymore. So it's never too late. It's never too late. Oh, that's fun. I'm doing it with script. Oh, okay. Oh, but yeah. It's a tough industry to have to deal with coding and script and everything like that. It interested me at one point too, but you got to be fairly, I want to say competitive, just always on the learning, always keeping up to date. And for the most part, we never stop, but it was just really competitive, and I realized I can learn enough about technology and and fuse it with dentistry to try to make something work and have fun with. So we find our parts, we find our paths. I need another piece here. What am I not doing? I need my 3-prong. All right. Yes, right now I found a site that already makes the animations for you. I mean, the dolls are already animated. That saves me a lot of time and stress. Oh yeah. Oh yeah. Yeah. That's the thing. A lot of these things come with a lot. There's a lot of shortcuts out there these days that automate or make that first beginning task just a little bit easier. So. Another question that I kind of was thinking today and everything like that. I know we've kind of been playing, or I mean, I should say that we've been kind of watching more Kingdom Hearts and everything like that, but did you, or have you ever played any Final Fantasy? And if not, that's cool. But if you do, or if you played Final Fantasy, which is your favorite? It's okay. I won't judge. My favorite Final Fantasy character is, of course, is Zack. Now let me see. So we're talking about Zack from Crisis Core, I believe it's called, from the timeline of Final Fantasy VII. Oh yeah, I played his PSP game. God, I fell in love. I think it's called Crisis Core if I remember right. I never played the PSP game. Yeah, I never played that game on the PSP. But I thought they also remade it too recently. I thought they did a remake of it, and people were making fun of it or something. I forgot what it was. But I'm not sure. I can't make fun of it because I never played it, but. Yep, it's the origin of Sephiroth. Yes, that's right. I recommend it. It's like Kingdom Hearts but casino type. Well, that's kind of neat. I'll have to get it set so I can play it, cause well for one, to start, I have never played 7. I think that's what this whole stage comes off of, is I've never played Final Fantasy 7. I've never played 8. I think the only ones I've ever played was 9, 10, the second part of 10. I think I did 12 with Vaughn, and then I played Final Fantasy 14, the online game, or whatever. Let's see. And who's your favorite character? Let's see. Is that in Final Fantasy the protagonist always going to be exactly? My favorite character overall, as far as a Final Fantasy character, is going to be Bart. Bartz. He is from Final Fantasy V. He is I don't know. I just always liked his concept. I always liked his style, his art style, and everything like that, and his kind of carefree nature to him. But Bartz was always my favorite. And I think the main reason why, too, is because when they brought him into Final Fantasy Dissidia, the PSP game, also PSP, right? The PSP game that had that was a arena-like fighter. That was where I was like, man, this is good. Onion Knight is another neat one. As far as a Dissidia character, as far as the Dissidia character, Onion Knight was neat. I'm not sure about his story, but yeah, it was neat. Excuse me, what was his name? The name for the guy that I liked was Bartz, and it should come up in chat here. But that's the character that I ended up liking a lot as far as a character. I played his game I played his game for a good amount, but I never fully beat it. But I liked him in Dissidia because I just liked his play style. He just kind of took pieces from everyone, used their mimic weapons or their used a version of their weapons, and it was a neat style. Okay, I never bent this piece yet. But I should play Crisis Core because I just like a lot of the PSP games. Those were definitely where it's at. It's definitely a fun system to play on that I miss so much. Looks like a nice, yeah. Essentially, pretty much he does. But that was always my character. And one time when I went to an anime convention, I cosplayed as him, and that was fun. I think I had my hair just the right way. My costume was all right, maybe like a 5 out of 10, but I really enjoyed that. That was a neat one. Game that I also recommend play is Third Birthday. Is that Third Birthday? Is that the Parasite Eve? Is it called Parasite Eve? Is that the Parasite Eve like game systems or whatever? I feel like I recognize that because my friends would always say that. Yep, that's what I thought. My friends always really loved that series, or I don't know what you would call it. But I never gave it a try. But it is the perfect time now that I actually have time to do a lot of these things and everything to give that a go. So that'll be another one that I need to put up on the list there. Yeah, I think one of my family members played it and she really liked the Parasite Eve games. I don't know, or series or whatever. So I think the first two Parasite games are Resident Evil type. Oh, okay. Did it switch it up when it got to Third Birthday? The brother of the Third Birthday is a crazy game. another neat game that me and my sister really got into was, shoot, what the hell was it called? Ironically, it's called Third Birthday because they lost the rights to the name due to legal problems. That's too funny. What was it? Invader. What was the game that we played? It was kind of like a really rough two-player game. It wasn't on PSP though. It was on probably the PlayStation 2. It was... You really liked it. You really liked it. It was like... I don't know, it was like people were turning into like monsters. Yeah, it was horror. It was horror-like. And at some cases we were able to play two-player style or something. I forgot what it was though. It was like The Last something. It was like title The Last something or whatever. Yeah, I'm pretty sure you remember. I'm pretty sure you have it there. Obscure. That's what it was. Obscure the something. That's what we. That's the one I remember playing. And the thing is, I don't really remember too much about it, but it was fun. It was different. We never really played any games that was kind of like that. What was it, like, super heavily story driven? As far as like what actions were going on, that's another one that's gonna be just a weird fever dream type of game that I'll have to get back into. Oh. Yeah, what did you do? Look over at your freaking library and just see it right there on the playlist? My favorite style of play is always Battle Against RPG, Final Boss, like Kingdom Hearts. It was the second one thing. Yeah, that obscure game was the second one. And it was just weird. And it also ended all weird, too. And I don't know what the hell got us into playing that. I'm pretty sure it was some type of, somehow you found it. Maybe it was just something that we got through GameFly. Let me check the Discord real quick. In fact, I want to buy Nier Automata games. Never played any of those games either. That would probably be a neat one to jump into, especially since there's so many games in that series, I believe, if I'm thinking of it right, that that can fill a good amount of time on its own. I need to go and move these down. Oh, my Discord just finally updated and launched. Let me see. That's right, the Aftermath. Yes, that's right. Oh, it's on Steam? Oh, that's tight. Oh, that's actually pretty cheap, too. That might be one of them that we jump into. You don't even know what the story is about Nier? No clue also. Super blind. Like I've been telling you, I have not been really in the gaming sphere lately, so everything is a new experience, and I don't really even watch too many, I don't really watch Let's Plays or anything like that. I don't really watch too many reviews or anything, so a lot of times it tends to be a fresh playthrough and experience for me when it comes to a lot of these games. This game is called Obscure. What the hell was it? Obscure the Aftermath, right? Obscure 2, the Aftermath. Weird game. I don't even know what the hell. I don't even know what was going on in that game. It was just a. It was just an odd one. I don't remember anything. Let's see. Oh, that's right. It was That's right, it was a pair. Creatures. Survive. Survivors picked up the pieces were the last left and gone to college. Yeah, weird game. Weird game. I don't even know if I would recommend it, but it was just something that we played when I was young, and somehow it holds some nightmarish dreams in my mind. You already played that? Oh, okay. Loved it. It's the first game that scared me. Aw. So then in that case, like you were saying, that means you must be a fan. Well, I'm not saying you're a fan. You must have played the Silent Hill series of games then, I'm sure. Whether it was your cup of tea or not. I literally have the memory of the suspense. I imagine that a cockroach was crawling up my legs, and I ended up screaming. Oh, you're too funny, I swear. Okay, let's go and cut off these pieces here. The worst thing is that my mother was next to me. She ended up scolding me to stop that game. Oh, I can see it. I can totally see that happening. And I'm pretty sure same thing happened with us was, why are you playing that game? I can already hear it from, I can already hear it. Let's see, I can use this part. It's like my kids wanting to play certain games, and then later on they're scared that that game character is going to is around somewhere. I'm like, if you're scared, then let's not watch it anymore. But they're like, no, I want to watch it. Let's turn on my PSP and see what games I have. I love it. I wish I can do the same. I'm pretty sure I still have my old PSP. I'm pretty sure it's somewhere in this house. But man, it would be a chore to be able to just find the power supply or a USB type, was it a was that a mini USB that would actually be in working condition to power it. Oh, this sucker is going to be tough to pop. There it goes. Alright. Oh. If I had that console, if I have had that console since I was 7 years old, the reason why it lasts me so long is that there was a time where I abandoned it because the charger broke and I had to wait about 2 years. Isn't that the struggle, right? It's like, oh, my charger broke, and now I have to use this specific charger and hopefully it works. Or it's like, oh, I ran out of memory. I need to use a new special memory stick to be able to put games on there. or even just like if you have the actual discs, the UMDs, I think that's what they used to call it. That part of the device broke on you. Let's see what we have here. Silent Hill 2 teaser trailer. Oh, yeah, that's right that you were saying that. Sum 41 did a song for Obscure? Probably the first one. Say what? The funniest thing is that I unlocked my console myself and installed many games on it from that. Oh yeah, I still... I don't think you can call yourself a PSP owner if you didn't, what did we call it? Firmware break it, jailbreak it is what we used to call it and everything like that. That was the only way to play that because you knew that the disc mechanism would probably break on you or whatever. So that's how we've all played our games. I remember playing Patapon on it. I think I played one of the God of Wars on it, Olympus, whatever the hell it's called. I loved playing Monster Hunter on it. Monster Hunter was my favorite when it came to that. Birth by Sleep. I played Dissidia. I played Dissidia Duodecim 1-2 or whatever. I think I got a lot of my early games. What was it? It wasn't called Phantasy Star. Star Ocean 1, Star Ocean 2. That was another one that I liked playing. Yeah, Star Ocean 1 and 2. That was a fun one to learn for the first time on there. Oh, yeah, that's right. You had Persona. That was, what was that? Persona 3 probably was on there. Oh yes, a game that I remember fondly, and the only one that I played is in a war game is Resistance. Yeah, that's right. Resistance was on there too. Persona for me 3 portable. Oh, that's right. Yeah, because on the PlayStation Vita, that's where 4 Golden came out, right? For Persona. Okay, that makes sense. I've never played a Persona game. Well, Invader is pretty much one of the... Invader in the chat, to me, has always been the expert on Persona games, as far as I know. So if I ever had any questions, I usually just go and ask, them. Yeah. Yeah, that's the thing too. It's like I never really got into Persona too much, even though to me it seems like Final Fantasy, at least the turn-based Final Fantasies, but you just gotta be really into that mood. Oh, that's right. Another game series that we would play is Tales games, which my favorite of them all probably was the only one that I ever played, which was Tales of Symphonia. And I think we ended up playing that for the GameCube, if I can remember right, is where we played that. Pretty sure it was the GameCube. We are so old that we finally remember the PSP. Oh, I know, right? The PSP is definitely, has definitely carried our childhood a lot for us. I remember being severely mad if my PSP went missing. But shoot, I don't even remember. When did I get my PSP? I got it when I was probably barely started working, so like 2008, yeah, about 2008, 2009, I got it off of Craigslist, and that worked for me for a long time. I'm pretty sure the PSP that I have is in the room. We did have a memory card for it at first. Oh, we didn't have a memory card for Tales of Symphonia. Oof. I remember one experience I had was disappointing because I thought the first Kingdom Hearts could be installed on the PSP. Aw, did someone get you on? Did someone catch you on YouTube with a "This is how you install Kingdom Hearts 1"? That would have been cool. That would have been super cool. It probably would have been doable with. It probably would be super doable with the PlayStation Vita, but PSP's ambitious. Just being able to even use the web browser on the PSP was neat at the time too. I remember playing it when I was when I was doing dental assisting school. My PSP was always on me. Ooh, challenge. If the challenge is to install Kingdom Hearts on the PSP, that won't work. From what I heard. I challenge you when you can play play Spooky's Jump Scare Mansion. What's this? Spooky's Jump Scare Mansion. I don't think I've heard of this, but which makes sense because like we've gone over before, I'm terrible about keeping up with games. Let me see. Why does this character look like they're from Adventure Time when I look this up? Can you survive the 1,000 rooms of cute terror? What the hell does that mean? Spooky's Jump Scare Mansion, Smallfoot and Ghosts of the Seems cute. Yeah. What did you say? Look for the trailer so as not to give you spoilers. Okay. Okay, so then this is what I'm gonna do. I'm gonna get it. I'll get it. I'll play it tomorrow night, or I should say, well, today, because for me it's already past. It's already 12 o'clock. I'm pretty sure. I think you're like 1 hour ahead of me, so it's probably like 1:03 for you. But on the next stream, I'll get it going. I'll get it running, and it'll be fresh. I have no clue what's going on with it, but look for a Spooky's Jump Scare Mansion trailer like this. I recommend Halloween. Oh, look at you looking out for me. That would actually the Halloween special. So are you saying that is that that's something I should look at? Okay. I recommend the Halloween special. Okay. So then at that point, are you saying I should play it a little bit more closer to Halloween when everything's already more spooky, or should I play it soon? Because I can make it happen either of those points, or at either of those times. Pretty sure it'd just be better themed for Halloween. Alright. I think for the most part I'm done bending this. Let's go ahead and take my impressions out from my molds, let's go and take my cast out of the impressions that I poured up earlier. Let's go and kick off some of these overhang spots. Oh, it's because this lingual part, that's what's locking. I'm like, why is this so extra hard? Let me go and beat this out real quick. I just need to break this little lingual spot. Okay, that should give me a little bit more room to wiggle. Since this is the last time I'm going to be pouring these up, I don't really need the alginate in the spots that I have it. Okay. This one's going to be tough. Okay. And we got magic. It's it does seem cute. That's the thing. It looks cute, especially with the I don't want to say animation style, with the little characters that they're using, but I feel like I'm gonna have a hard time with it. I don't know. You might be setting me up pretty. You might be setting me up pretty good to get really spooked. And I'm pretty sure if I was to play it and my kids saw me playing it, they're gonna be like, "Oh, I want to play that too." Who knows? I'm just getting my impression tore up so that I can have an easier time to clean it up while it's still gooey. Alright. That's my lower. Get my upper cast done. That one shouldn't have any issues either. Okay, and here's my upper cast. Cool. Same thing, let's go ahead and pull the impression apart since I'm not going to be using it again. The purpose of the game is that it'll be 1,000 easy doors, right? You sound convincing. Nothing can go wrong. You got me suspicious right now. So that's always a good thing to kind of anticipate. When did this game come out too, actually? When did this? Spooky's 2016 so far that I see that people have been playing it. Is that even right? Yeah. I'm pretty sure it's been out for longer too. Huh. Play it with headphones at 101% recommended. Oh, you are terrible. But I feel you. I'm pretty sure nothing could go wrong. How did I tell you? If you're curious, look. Yeah. Good, that tracks right there. Let me see what's going on with this trailer. We gotta turn the computer sound down a little bit. Alright. Let's see what's going on here. How spooked am I gonna get? Let's see. There are two. Look for the one that says HD renovation. Let me go and take a look at that here. Then. I don't want the full game. I just want the trailer. Okay. Game trailers hubs. Okay. Let me see what I got going on here. HD renovation. It seems fun. Saw a little red there. Okay, there's some red on the floor. Some green stuff. Oh gosh. Oh no. Oh, whoa. Oh. Oh, Lord. What's this? Why did it change? Oh my gosh. You monster. It was a game. Huh. I was not expecting that. But I will still do it. That's gonna that should be fun. I think the last game that I played that was kind of along that horror genre was what was it called? It was for virtual reality. It was for VR. It was Phasmophobia. That was kind of the last one that I played that was horror theme, and I played it with the VR headset, and I played it on the computer and everything. And those got to me, but I wasn't. But eventually I got good at it, and I was okay. That technically there are 3 games: the normal one, Hospital, and the Dollhouse. What do you mean? and they're all that similar type of style and such. Oh, there is a Dollhouse one. Oh hell no! Oh no! Oh no! No! Oh, I'm not doing that. I'll stick to the normal one at this point. How could they be doing that? I mean, the game HD renovation has the 3 games. Oh, okay. So that'll be an enjoyable one to have to go through. Well, I mean, I'm a guy that wears teeth on my as a ring, so I should be up for the task. It shouldn't be that bad. But that's gonna be a fun one. That is gonna be a fun one. In the meantime, I'm gonna prepare to have those ready and still go super blind into that game. So that will be a future thing that we do, definitely. And you can watch me get super spooked, super scared, and have headphones on for that time, and then I won't be able to go to sleep. I'm pretty sure. With what I thought was what it looked like at the beginning, definitely shifted to a whole other thing pretty quick off of that trailer. That's gonna be fun. It's fun. The wait will be worth it. Yeah, that'll be fun. Oh hey baby. Don't worry, I was about to log off right now, so I'll get you. Come here. You want Papa? Oh, okay. It's okay. No, it's okay. We're gonna go to sleep right now. Oh. All right. Let's see. Well, you know something? There are one of those games that are just watching videos. By just watching videos scares you. So technically, we're gonna be both scared. Well, I guess to start off, have you played it, or have you just watched videos of people playing it? Because I haven't done either. You tired, Pippi? Yeah. Okay, here, lay down on me. Oh, good girl. It's good that you're looking out, but thankfully I don't. I just have a scaredy cat problem. That's all it is. And the question is not a joke. Nah, I'm as far as I know, I'm good and never had any issues or anything like that. So, should be no problem. Okay, everything is fine. You can open the 1,000 doors. That sounds like it's going to be a neat challenge. I can't wait, and I feel like it can't come fast. It's not going to come fast enough. But apart from that, I am going to call it a night. Got to get this little darling here back to sleep, and we'll see how everything goes tomorrow. But we will definitely get that prepared. Sounds really excited. Sounds like a lot, but it takes maximum 3 hours. Oh, that's not too bad. I mean, 3 hours is a lot, but that doesn't seem too bad. Yeah, it's time to sleep. Yep. But good chat. Thanks for sticking around and everything. I see that we have like five weirdos here with us, looking at teeth and stuff like that. So hopefully we can see you guys next time. Shouldn't be too long, but probably tomorrow night. And take it easy, y'all. 3 games.